The lumbar fusion domino effect. It's a common misconception that once you have a lumbar fusion, the other levels will fall like dominoes. Does having a lumbar fusion increase or decrease the probability you will need another spine surgery? In fact, a lumbar fusion will decrease the probability you need a second surgery. How is that possible? That's the topic of this video. We appreciate you watching. Would you please take a second and give us a like and subscribe? When we talk about spine pathology, we divide the spine into the injured level, the adjacent level, and then the rest of the spine. When an individual who has had a previous lumbar surgery needs a second surgery, it is almost always at the adjacent level. What is the natural history of the adjacent level? If there's an accident and you damage a disc, that disc will lose fluid and collapse. As the injured disc collapses, the bone that it's supporting also moves, and that places stress on the adjacent disc. Prolonged stress on the adjacent disc will lead to collapse at that level as well. Because of the curve in the lumbar spine, normally an individual's weight falls in back of the spine. That protects the discs. When the injured disc and the adjacent disc collapse, the lumbar spine loses its lumbar lordosis or curve. The center of gravity moves forward, placing the force down the spine. More weight and force causes the injured disc and the adjacent disc to break down even faster. Even without surgery, at the injured level, there is a cascade of events working against the adjacent level. A fusion is when the surgeon joins two bones together to stop all motion between those bones. In a collapsed, injured level, there is very minimal residual motion. Therefore, fusing an injured level does not result in a significant loss of motion to the lumbar spine. In other words, a lumbar fusion does not change the cascade of events that are taking place in the adjacent level. Modern fusion techniques are capable of slowing the cascade of failure that occurs at the adjacent level. Here at the El Paso Spine Center, we do a percutaneous, minimally invasive outpatient lumbar spinal fusion. It is the least invasive lumbar fusion. Percutaneously, a mesh balloon is placed in the disc space and inflated with a mixture of bankbone and stem cells. This restores the normal height and alignment of the disc space, realigns the spine, and minimizes the stress that is occurring at the adjacent level. Studies show that this process dramatically reduces the collapse of the adjacent level and the need for secondary surgical procedures. In the appropriate situation, a minimally invasive lumbar fusion produces amazing results. When we talk about lumbar fusions, there are a couple of very important points to keep in mind. Number one, with a lumbar fusion, you will not lose a significant amount of motion in the lumbar spine because the level being fused does not have a significant amount of motion. Number two, a lumbar fusion is an end-stage surgical procedure and should only be considered when other more conservative treatment options have failed. Number three, lumbar fusions for the treatment of back pain from degenerative disc disease have very low rates of patient satisfaction and are not generally recommended. Thank you for watching this video. Remember to give us a thumbs up and subscribe. Tell your friends and neighbors to watch. Share the video. Thank you.